And everybody else out there who maybe had some Super Bowl food yesterday. This Heart Health Month, we're talking with local experts about taking care of your heart. And today we're talking about managing your cholesterol and why treating high cholesterol is safe, effective, and inexpensive. So Dr. Amy Marino is going to help us out. She's a MedStar Health cardiologist. Hi, Amy. Good morning.
Hi, thanks so much for having me.
That's all right. So that's my first question, right? So yesterday, Super Bowl Sunday, we're eating everything under the sun. Is it okay to have cheat days like that?
I mean, the better you eat, the better off you'll be, but I don't expect you to eat perfectly every single day.
All right, fair enough. So we shouldn't feel too guilty as long as maybe now we start the post-Super Bowl health kick. Talk a little bit about cholesterol. We hear the name thrown around a lot, but what is it exactly that it is and is doing to us?
Yeah, cholesterol is actually what we call a lipid. So it's a fat-like waxy substance that circulates in the blood. And it's actually not inherently bad. We need it to build our cells, for hormones, for vitamins, but when you have too much, it causes problems.
And we hear, when you say it's not inherently bad, we hear the terms thrown out, good cholesterol, bad cholesterol. What's the difference between the two? Like, as far as what they do to us and then how we get them?
Yeah, the bad cholesterol is the LDL, or the low-density lipoprotein. And the higher the level is, we know that the higher your cardiovascular risk is. And so we want that to be lower. The HDL is what we've called the good cholesterol, and that is protective, but only to a certain degree. If it's too low, then that can increase your risk, and we think even now if it's too high, that increases your risk as well.
So we want to keep that happy balance. What is it that we're getting this from? I mean, I'm assuming it's from foods that we eat, right? So what contributes to the so-called good cholesterol and the so-called bad cholesterol?
Yeah, the liver actually makes most of the cholesterol that you need. And so a lot of the extra comes from the things that we eat. So things that have high saturated fats, animal products, eggs, even sugar and highly processed foods aren't good for us. And the HDL, that's really from your genes, your exercise, and eating well.
So is that I guess, one of the keys right there? If you just start with a good diet and a good exercise routine, is that something that can help with the balance?
It absolutely can. We want you to eat really well. So more plants, more fruits and vegetables, less animal products, and to be exercising about 150 minutes a week of something that's moderate intensity. So should be getting you sweaty.
All right. So that's all and good if we just hit a reset button and we started at zero, right? And then we just say, if I exercise, then I'll be fine. What if we already have maybe had some bad habits in the past? How long does that take to correct? And is it always correctable?
Yeah, that's something that has happened over a really long time, and it is correctable. And we know that just lifestyle isn't always good enough. And that's when we have tons of medications that we can effectively treat your cholesterol with.
So what's the first step? I mean, is this something that we can tell just through a simple blood test?
Yes, you should be screened. You should get a cholesterol panel, and that will tell us what your HDL is, what your LDL is, and what your triglycerides are. And you can then talk to your doctor about what your goal is and whether you should be on medication to reduce that risk.
All right, when you talk about the liver that is actually producing these, can external factors there, like if you have liver damage, maybe you drink a lot of alcohol in the past or something like that, could that impact your cholesterol level as well?
Well, there are lots of different health conditions that can increase your risk of having high cholesterol and high cardiovascular risk. So kidney disease, liver disease. We know that drinking alcohol is not good for your triglycerides, and that's kind of all wrapped up into your cardiovascular risk and your cholesterol itself.
All right. So as far as if you come in, how you get your blood tested, and some doctor like yourself is just like, we're going to have to do what we can to try to lower this a little bit. What is the risk? I mean, is it essentially just like squeezing the blood vessels, like your risk of cardiac arrest? What's happening inside the body?
It's kind of like mixing oil and water. So the cholesterol particles don't dissolve in your blood, and they can make their way into the blood vessels, and that causes plaque. And the plaque builds up, and it can narrow the blood flow to your vital organs. And then those plaques can actually rupture, break open, and cause heart attacks and strokes, which is really what we're trying to reduce the risk of.
Absolutely, and we want to be healthier. And this month, it's obviously Heart Month, and literally and figuratively with Valentine's Day, but we got to stay healthy too. That's one of the things we need to watch out for. So maybe after Valentine's Day chocolates, we'll start a workout plan. I'm not trying to kick the can down the road, Amy, but I'm just saying, like, life has its little things we need to splurge on.
Talk to your doctor about what your numbers are and what your goal is, because everyone's is a little bit different.
All right. I'm glad you got the final word in, because I would have just pushed people toward the chocolate. February 15th, we're going to do better. Amy, thank you very much. MedStar Health cardiologist joining us now.